When a person's own immune system starts attacking the peripheral nervous system, it seems so strange and bizarre. But yes, this does happen in the rare autoimmune neurological disorder called the Guillain-Barré syndrome. This is triggered by an immune response to infection, which may be of bacterial nature or it may be of viral nature. As a result, the body loses the ability to recognize its own peripheral nerves and starts attacking them, thinking that it is attacking the virus or the bacteria itself. The disease progresses for around 2 to 4 weeks and then it starts stabilizing and the symptoms start getting normal. Normally, there are just around 2 cases per 100,000 of the population and the mortality rate is around 7.5%. But recently, from the past few weeks, the district of Maharashtra in India has seen a number of suspected cases. Till the 4th of February 2025, there were around 163 suspected cases and 5 people had already died of this and 28 more are already on ventilators. So we need to know what is it and what can you do about it? How can you recognize it? I'm Dr. Mariam Atiq. As it attacks the peripheral nervous system, so the first symptoms to come are of weakness and tingling, which starts mostly in the limbs, the feet, the hands, and then the disease starts ascending upwards, involving the other muscle groups. As it reaches up to the face, there can be symptoms in the eye like double vision. When it is affecting the facial muscles, then it can cause difficulty in speaking, difficulty in chewing, difficulty in swallowing. There may be drooling of saliva from the sides of the mouth. Then as it starts affecting the lungs, the muscles around the lungs, then it can cause difficulty in breathing. And similarly, when the heart muscles are affected, then it can cause an increase in the heart rate. It can cause high blood pressure or low blood pressure. Eventually, if the disease is not contained, this weakness and tingling, it moves on to numbness and then total paralysis of muscles can occur. When this paralysis happens with the respiratory muscles, the people may have to be put on ventilators and this may prove fatal. If paralysis develops, then it takes a few weeks to up to 6 months for the people to recover, and for some, the symptoms of weakness and tingling and this difficulty in walking or talking can go on for years and years. It actually damages the nerves, the myelin sheaths of the nerves. To make it easy, I would say, like the electrical wires that you see in our day-to-day life, they are coated with plastics or something so that the electrical impulses do not go and damage the other people or the articles. In the same way, these nerves can be considered as these electrical wires within the body, and they are also coated with the myelin sheath, and this autoimmune disorder attacks these myelin sheaths and therefore this damages them and causes inflammation, due to which we get all these symptoms. It needs immediate intervention, and you must take people who are exhibiting such symptoms to the doctors as soon as possible, because although it is treatable, it progresses very rapidly. There, the diagnosis is made by taking the spinal taps, that is lumbar puncture is done, and the nerve conduction studies are done, which can easily tell that the person is suffering from this disorder. Now the treatment. The treatment in these cases is mostly plasmapheresis, that is plasma exchange. The blood of the patient is taken out, it is treated. This damaged, all the damaged cells and all those infection causing cells, all those damaging autoimmune cells, they are removed from the plasma, and this treated blood is then put back into the body. Then there can be the immunoglobulin therapy, in which the IV conduction infusion of immunoglobulins. Those are the Y-shaped proteins. They are the antibodies. They are taken up from other people and they are given to the person, which help them fight the disease. Then for those who are suffering with paralysis of the muscles in the chest, they have to be put on ventilators so that the breathing can be aided. Then those who are having difficulty in walking or talking, different kinds of physical therapies may be required for them. So you must contact the doctor. This year only, the outbreak or the suspected outbreak that I'm talking about was first seen in a child who was just 6 years old. He was in school and one of his teachers reported that he was having difficulty in his work. She had erased some parts of it and she had asked him to rewrite again, and he was simply not able to hold his pencil and do that writing. And later on, he was taken to the hospital and he was the first diagnosed case of GBS this last month. So it is rapidly progressing. It seems so strange, but sometimes the people whom you are talking to in the morning may end up with paralysis by night and may be put on ventilators within 24 hours. But for others, it can be a little more time giving and you may get time for recovery. So please take care, share the information, recognize the symptoms and reach to the doctor in time so that you can be helped out. Thank you and have a very nice day. Assalamu alaikum.